It's really great to be here today with you to talk a little bit more about how we can provide more effective feedback or feedback that works. Hold on tight because it's going to be fast and furious. So first of all, we'll start off with why feedback's important. And then we'll talk about the components of effective feedback. And then I hope to provide you with 3 effective feedback frameworks. So why is feedback important? It's a mechanism of self-improvement and lifelong learning and adaptability. We all have blind spots. And so feedback helps us provide insight into those blind spots. Feedback is also an essential element of any relationship that wants to grow, and it is a great communication tool. Furthermore, it allows for self-improvement in individuals and in teamwork. This article by Forbes shows that employee engagement improves with honest feedback, and honest feedback improves employee engagement. Lastly, and I think most importantly, in the educational field, it allows for growth. We provide instruction, we provide a safe environment where then individuals can practice that instruction, practice what they learned, apply what they've learned. That gives us direct observation and an opportunity to give them feedback. They can revise based on that feedback and then continue to grow. Feedback is intrinsically important to what we do every day. And if you still don't believe me, it's required by ACGME. ACGME requires us to be effective educators. In order to be effective educators, we need to model with a conscientious plan that sets goals at the beginning, sets expectations, and then provides feedback along the learner's journey. Furthermore, it's what our learners and fellows and our faculty want. Based on our needs assessment that we conducted back in March of 2021, our faculty highlighted that they want more education on how to give effective feedback. And our learners and fellows also stated it was a top 5 priorities for them to teach our faculty and themselves on how to give effective feedback. One of our learners quoted, "Feedback from attendees is super unhelpful. It's so vague that it doesn't make sense. Faculty need to give feedback in a reasonable time frame. If real life examples were used to demonstrate what needs to be improved, it would be helpful." So not only is feedback important for growth, it's required by the GME and our learning environment needs it. And this learner highlights what is effective feedback. So what are the key components of effective feedback? Number 1, it's bidirectional. It's a conversation. It's interactive. It's reciprocal. It is good feedback is feedback that, first of all, a good feedback session is highlighted by the fact that we as faculty and as educators seek feedback first. So we set the ground rules and we set a safe learning environment by asking, what feedback do you have for me? What feedback do you have for all the other learners in the environment? And then seek first to understand. Ask them what they think about their own growth, their own journey as a learner. Encourage self-assessment, ask for self-reflection, which provides us insight into where they are and provides us insight into their own perspectives, perceptions of how they're doing. So seek first to understand. Secondly, it allows us formative feedback that is on the spot, allows us for direct observation, or actually demands direct observation. It demands that we are in the environment where the learning is taking place. That provides us an opportunity to not only directly observe them, but then give really constructive, timely, specific feedback, providing specific examples regarding certain behaviors and actions that they're taking that we want them to take to improve a specific behavior. When I'm working with a really advanced learner, like one of our palliative care fellows, I ask specifically what they want me to observe and what they want to get feedback on. So then I know exactly what to look for, and it's very specific. Remember to remain objective and honest. We are focusing on certain behaviors, not characteristics, not an individual's character. We are removing judgment from our feedback and really focusing on what objective goals that we can highlight and give feedback on. Whether it's in individual specific goals, whether it's how they provide patient care, or maybe overall how they contribute to the team function. So just remember to remove judgment. This, again, focus on the behavior, not the individual's character. And lastly, which I think sometimes we honestly forget in feedback, what gives high quality feedback is that it's at the end is action oriented. We're equipping them. We're asking them, how do you want to move forward? Knowing what we just know, knowing what we just talked about in regards to kind of where you are right now along in this journey. The owner of this process should be the learner. The learner should own this process but how do we follow up and create action plans for them going forward? So components of effective feedback, again, it's a conversation, it's interactive, it's bidirectional. Ask for self-assessment, it's timely, specific, objective, honest. We've removed all judgment. And lastly, it's action-oriented. Now that we've talked a little bit about why feedback's important, the components of feedback, we're going to give you 3 strategies, 3 strategic frameworks to use to provide feedback. My favorite one is the last one. These first 2 have been adapted by an AOE lecture series created by Susie Martinelli, Lindsay Wilson, and myself. So we'll talk first about the W3 model. What worked well? W2, what did not work well? And then lastly, what could be done differently next time? So for example, what worked well? Your notes are concise and include the relevant information. You seem to be doing well with this. What didn't work well? Well, I noticed that at times when you communicate in the patient's room, you're not talking directly to the patient and using medical jargon. It's very specific, very timely. And what could be done differently next time? First of all, ask for them, ask their input. How do you think we as a team could improve our communication at the patient's bedside? And then what specifically can that individual learner do to be a more effective communicator? And then once they've given their input, you can say, I agree, or I disagree, or here's some other thoughts. I agree, breaking things down in a more simplified language would help your patients and others. Maybe even sitting down at the patient's bedside will help you talk more directly to the patient. So again, the W3, what worked well, what did not work well, what could be done differently. Another framework is more of a conversation. It's the open body closed framework. So what is your opening statement? Your opening statement allows an opportunity for you to align yourself with your learner. So we're going to provide a conversation about feedback. This is the specific kind of feedback that we're hoping to do during this conversation. The body of it is a 2-way exchange of information. Again, feedback needs to be bidirectional. So it allows you an opportunity to sit, listen to the self-assessment, listen to self-reflection, listen to their own feedback, allows the learner to share feedback for you, and then allows you to provide feedback to them. It's a pretty productive conversation, and it also helps with problem solving, moving to the clarifying commitment at the closing statement. The closing statement, again, highlights it's an action statement. It's a benchmark. How are we going to follow up what we just learned about and with the actions and equipping them with actions kind of going forward in action step. So the closing statement allows us to follow up with the learner about what to do next. And lastly, my favorite is guide. Guide, it was adapted from Vital Talk, which we use as palliative care providers and any provider for faculty when we talk up to patients about serious illness. So and I've adapted this to feedback because I think it's really fruitful. So what is guide? G, get ready. So setting the stage, right? So it's the opening statement for the conversation guide that we just talked about. Being in the right place. Do you want to have it? Where are you going to give the feedback? Who do you want to be in the room when you give feedback? Is it the whole team or is it just the individual themselves? You understand. So this allows you and reminds you to seek first. So ask for the learner, for the resident, for the medical student, the fellow, ask for their self-reflection first. And then ask for feedback on the team. Ask for feedback about yourself. We use this philosophy in palliative care called ask, tell, ask. And again, I use ask just as a reminder to ask for understanding, their own understanding, and then feedback for the whole team. So get an understanding allows for perception as well. And then inform via invitation. Again, I ask again, ask, tell, ask. Ask once they provided self-reflection, once they provided feedback on others, then I ask, is it okay for me to give you feedback now? Is this an okay time? Again, it allows the learner to it flattens the hierarchy. It allows the learner to kind of have a little bit more control over their environment. And then inform providing the feedback, right? This is the juice. This is the why we're here. Giving them direct, honest, concise, and again, behavior-oriented feedback. And lastly, allow for self-reflection and allow for time for that learner to reflect upon what you just shared with them. Dignify emotion doesn't have to be in all feedback sessions, but if you're giving really difficult feedback to a learner, I think it's fair to say that sometimes just validating their emotions, man, this can be really hard. This can be really frustrating. This can be disappointing. So name that emotion, respect it, and know that you may get the emotion wrong. They may not have that emotion at all, which is totally fine, but it opens up the conversation. If it is a really difficult feedback session to have or to hear for the learner, it allows them space to actually have that and to experience emotion. And then lastly, equip. It reminds us that we need to provide them with the next step. We need to provide them with next action-oriented steps and then have a follow-up and a follow-through plan. So guide, get ready, understand, inform via invitation, dignify that emotion, and then equip them for what's next. So our take-home points regarding feedback, it's important. It's necessary for growth, and effective feedback is what our learners want and what they demand of us. And lastly, it's required by GME. So if you don't believe that it's intrinsically valuable for personal growth, it is a requirement that we're asked as faculty members to perform. And then what is quality? What are the qualities of effective feedback? What are the key components of feedback that works? It's reciprocal, it's bidirectional. Learners feel like it's a little bit safer environment if they're also giving feedback. It allows for self-assessment. It allows for self-reflection of the learner. It's timely, it's specific, it's honest. Again, it's behavior-oriented. We've removed all judgment. And then we've been equipped with an action plan going forward. So we've equipped that learner on how to improve and how we're going to assess that improvement. And lastly, we provided you with 3 really good feedback frameworks: guide, W3, and conversation. So thank you for your time. On what we just discussed briefly was formative feedback, feedback that you give on a daily basis or maybe every other day basis to your learner. We also ask you, this is a shameless plug as from a residency leadership perspective, we ask all of you, all faculty members, to perform more summative evaluations of our learner at the end of a rotation. I would make the argument that you can provide the same framework that we just talked about with the formative feedback, the guide, the W3, with your written and kind of summative evaluations. This evaluation we commonly get: great job, pleasure to have on service. That's not specific. That's not behavior oriented, and many times it's just 9s down the road. We really need more constructive feedback to assess our learners where they're at so that they can continue to grow into the position that we hope for them to be. So thank you again for your time. And just as a reminder, feedback's not simply the control over the system, it is an instrumental in our growth. And here are some additional resources. I'm happy to help you in any way possible going forward. And then here's some references. Really appreciate you for taking the time to listen to this feedback session. Have a great day.